afternoon, Tembekile, and good evening to the viewers of Newzroom Afrika. Since the General Secretary of the South African Federation of Trade Unions spoke to you 2 weeks ago, we have not received any complaints specifically from workers to the union. However, what we have observed is that the CCMA reported in an article published by Media 24 yesterday that they have received about 30 complaints from workers about the mandatory vaccination in their workplaces. And therefore, at the current moment, the only thing that we would have received is the notifications to workers that they would be going into, in 2022, their companies and institutions would be introducing mandatory vaccination.
And 30 is a small number, relatively, when you compare it to the size of the overall South African workforce. Do you worry that there's perhaps underreporting by employees who aren't happy with mandatory vaccination?
Yes, there would be the underreporting from employees, but also because many companies have set to introduce mandatory vaccination starting January 2022. So we know that from 2022 onwards, January onwards, we would see a high increase of these kinds of cases emerging from workplaces, because various other companies have already announced that. The companies which have announced mandatory vaccination, which have already begun rolling out such a program, are not too many at this current moment. The ones who have announced it in a futuristic manner. That is, it would commence only next year. And that is the reason why perhaps we have received few of these kinds of cases.
What then, Trevor, is SAFTU's preferred approach to mandatory vaccination? Is it a more industry or sector-by-sector approach, let's say, for example, for people who are in essential services, nurses, doctors, teachers, and the rest of it? Is that how you'd like it to be done?
No. The South African Federation of Trade Unions met from the 29th of November to the 1st of December at the Central Committee, the second Central Committee. At that meeting, the worker leaders and the shop stewards who had been delegates to that CC decided that they do not accept and would reject mandatory vaccination. So the official position of the South African Federation of Trade Unions at this current moment is that we reject mandatory vaccination for two reasons. One, because it violates and infringes on the constitutional rights of workers and people in general. And secondly, because it sets workers for potential suspensions and dismissals from workplaces.
But mandatory vaccination also comes with a clause where people are allowed to give reason why they're not going to get vaccinated, for example, be it religion, health purposes. Is that not enough of a clause?
The people who are currently advocating for mandatory vaccination are using two pieces of law. The first one is the Occupational Health and Safety, which puts the onus on the employers to ensure that workspaces and workplaces are safe and healthy. Secondly, they also rely on the National Health Act, which in Section 7 says that there's no need for a consent in the case that a particular medical activity would take place in the interest of the public. However, those relying on this second piece of law are caricaturing it, because in subsection 8, or in section 8, which is succeeding the section which they are relying on, says that this can only be taken, that is a decision to vaccinate or take medical procedure without the consent of a person in respect of public interest, says that, section 8 says that they cannot continue with that unless they at least give the person who is going to, his right will be taken away to give consent, a participatory role in that particular process. And in this process, many organizations like the South African Federation of Trade Unions have not been given any platform where they can participate in this consultation, which the president opened in November. And as a result, it is not only us, though, it's also community organizations and many other organizations which are not included in the mainstream parliamentary procedures and spaces. In this instance, we speak about the assemblies of the unemployed, the students' organizations. Most of them would have not given that particular process and participatory platform in which they can participate in this process. So as a result, we say that as the South African Federation of Trade Unions and of course our allies in the working class movement would be rejecting mandatory vaccination to be introduced. Firstly, as I've said, that it's an infringement of constitutional rights, but most importantly, because we have not even been consulted.
So will you take this to court then to fight it? Given that, of course, I'm asking you this question in the context of the fact that government has not yet pronounced at its level what mandatory vaccination should look like. We only have a handful of companies that are already doing it.
Can you repeat that?
My question was, will you then as SAFTU take this to court if you're saying you are rejecting this and you see it as a constitutional infringement on the rights of individual workers?
Yes. The South African Federation of Trade Unions Central Committee, which I mentioned at the beginning of this, decided to take this process to the Constitutional Court to get a declaratory order in which we believe that we would be able to win because, like I said, the caricaturing of the National Health Act to trump on the constitutional rights of people, we think as the South African Federation of Trade Unions, by taking this to the Constitutional Court, we would win.
When do you expect to file the necessary paperwork then with the Constitutional Court?
The process would start right at the beginning of 2022.
So if things continue the way they are, right, where majority of people in this country aren't vaccinated, will the frequent lockdowns that are likely to follow with new variants and a mass spread of the virus, would all of that be worth it economically for labor in this country? Is it a risk that you think is worth taking for workers?
We actually think that there is some form of hypocritical patriotism that the ruling party and the employers have actually been pushing in this country in relation to vaccination, but most importantly, the spread of COVID-19. What they have not done what they've not done is to ensure that they capacitate the healthcare facilities. We have shortages of beds. The third wave in June, July exposed that in Gauteng, but most importantly, we are sitting with 24,000 of healthcare posts which have not been filled in this country at the time of a pandemic, and they've been going on, in fact, even closing some clinics in various communities. So the reason why we say this is a hypocritical patriotism is because whenever we are trying to defend the constitutional rights of workers and of people in particular across the country, they involve the fact that we cannot say that because infections would rise. Is that what we are willing, for instance, the way you put it, is that what we are willing to sacrifice, to see many lockdowns coming because people have not been vaccinated?
But are you, though?
Hypocritical patriotism.
Are you, Trevor,
in the main...
Sorry to cut you off. I mean, you're right. We can have a conversation about how government has not resourced hospitals, government has not prepared enough from its end to protect as many people as possible. But we can also ask you the question as Labour, if that is a future that you're willing to accept if most people say they don't want to get vaccinated.
Yes, it's their constitutional right at the end of the day. The very basis and the bedrock of democracy is to ensure that people have their own right to choose whether not to vaccinate or vaccinate.
Okay.
And if that the consequences, therefore, is that there will be continued lockdowns, let it be, because it's the people who have chosen that particular path.
Thank you very much.